As we all know, rural and urban Wisconsin employers have begun to experience the retirement of baby boomers in record numbers. What is particularly true in the healthcare sector is that an aging population not only reduces the supply of workforce, but also increases demand, as the need for healthcare really takes off as we get into our senior years. While it is important to note the long-standing challenge for rural Wisconsin communities to recruit healthcare practitioners, the current supply of health professionals is at best okay for our urban communities. In any event, the available forecasts show that both urban and rural will soon face major shortages. Here are a few examples of the impact of current shortages. Current healthcare professional shortages in our rural communities can mean patients wait longer for treatment, get less treatment that is optimal, or receive no treatment. Or it means they leave their community to get needed care, take revenue out of the local community, weakening the local hospital and clinic. It often takes over a half year at best for a rural hospital to recruit a physician. One co-op member in a very attractive location has been recruiting a practitioner for their behavioral health program for over a year with no results. Unfilled positions lead to more pressure on existing staff, more burnout, and more early retirements or loss of staff to urban communities currently without these challenges. When a rural clinic loses a physician, they don't just lose the direct patient care and financial support to the community, they almost always lose a teacher. It is not uncommon for one physician to annually train several medical students, resident physicians, and physician assistants. Without this training, these learners are not exposed to the benefits of a rural practice and are less likely to consider working in a rural community. Rural emergency rooms are often mentioned as the #1 service by hospitals due to rural farming accidents, vehicle accidents, overdose, stroke, and cardiac events. This requires 24/7 staffing, which is very difficult and often requires the use of very much more expensive interim staff from agencies. If 24/7 coverage is lost, lives will be lost and the community less attractive to live in and to start businesses in. Preventable deaths are higher in rural Wisconsin. The current shortage of certified medical assistants can lead to practitioners not having time to discuss important health improvement opportunities such as diet, exercise, vaccines, mammography. But what about the longer term? One that we must address now so to limit the damage of major shortages in the not-too-distant future. To ramp up production for advanced care practitioners like nurses with a bachelor's degree or physicians, it is not unreasonable to estimate 10 to 15 years from starting an expansion of education and training sites to having experienced practitioners in the field ready for a full practice. In that light, we are already in a crisis, as the Wisconsin Center for Nursing is forecasting a statewide deficit of nurses equal to 15% in 10 years, and with the Wisconsin Council on Medical Education and Workforce forecasting a statewide deficit of primary care physicians equal to 14% in 15 years. Statewide figures of this magnitude will hit most communities very hard, but especially our rural communities who, as noted earlier, traditionally experience staff shortages even when times are good. The Federal Centers for Disease Control released a report in early November that rural communities continue with higher rates for all 5 of the leading causes of death: heart disease, cancer, unintentional injury, chronic lower respiratory disease, and stroke. One of the root causes of these disparities is rural Wisconsin's slow recovery from the last Great Recession, leading to fewer jobs and less income, major contributors to poor health. A second is the chronic shortage of rural healthcare workforce. The bottom line, the workforce shortages our state is already experiencing and will increasingly experience will make access to affordable health care unacceptably more difficult, no matter how it is paid for.
Hello, I'm Dan Smith. I'm President and CEO of Cooperative Network. Cooperative Network is an association of 250 cooperatives from 12 different business sectors in Wisconsin and Illinois. In the last 10 years, mechanization, specialization, larger farms, new technology, and new methods of farming, new management systems have greatly reduced the number of farms, have greatly reduced the number of farm families, and have really changed the workforce requirement for agriculture. 1 in every 9 jobs in the United States is tied in agriculture to some way. And that's where we're really seeing the growth for workforce in the future, is in the support systems for agriculture. When we talk to our cooperative managers, they all will point to the need for labor to address their workload as one of their primary concerns. With the new technology that is available, the type of person that our farmers and our cooperatives are looking to recruit has changed drastically. was speaking to one of our farm co-op managers. He pointed out the window and there was a new crop pesticide applicator, fertilizer applicator parked out there, and he said that machine cost us $350,000 and it runs primarily 4 months of the year. And the person that I need on my workforce to run that operation has to be so technical and so trained to run that piece of equipment that that person could probably get a job any other place, in any other business today. I need to attract that, find that person, attract that person, make sure that the compensation is competitive. And then 4 months of the year, I'm going to ask that person to work 7 days a week, 16-hour days. So I'm at a disadvantage. So I'm competing for the same technical skill, but because of the seasonality of agriculture and because of the constant change that we are seeing in agriculture, I need to retain that person in my business, somehow afford them, and then give them the professional development and opportunities and lifestyle opportunities that any other business can give. And that's a challenge for us. When you look at the impacts on agriculture over on a national basis, if you look back to the late 80s, early 90s, there was great concern in Wisconsin that Wisconsin's dairy industry was losing out to California's. But the thing that moves agriculture systems nationally are two things. One is natural resources and the other is labor. So California's dairy industry was growing by leaps and bounds until they ran into issues with water and they ran into issues with the price of land. As the population in California grew and the competition and price of land became prohibitive, and the cost of water, of being able to use the water that they needed on their farms became too high, we saw a shift back to the Midwest. That really helped bring Wisconsin's dairy industry really seize that opportunity since the 90s. When you look at what are the challenges for the future, so if one of those challenges that we've identified is going to be who's going to do the work, the labor, they're going to move again to where that labor can be found, and access to land. So we are already starting to see some trends of the dairy industry relocating to the Dakotas and to Idaho and to Texas.
As a manufacturer, you look over the last 15 years. 15 years ago, when we were recruiting workers, there were workers to recruit. Then it was a matter of working with the technical colleges, getting the training set up, doing the training ourselves. But we had a pool of potential employees. We don't have that today. We don't have the population anymore. Now it has to revert to recruitment and retention. Some of the barriers that have to be overcome really are a better collaboration between private, public, and quite frankly, nonprofit. And we're here in Waukesha. Waukesha is almost the gold standard for the state. You know, the Business Alliance here collaborates with the technical college and with business in this area to connect all the dots, the students, the need, the requirements, and it really works well. I think the same thing is being done in the western part of the state, La Crosse and Eau Claire. It's being done in the Fox Valley. But it needs to be really raised to a much higher level of urgency. If we don't really get on top of this and really seek out these collaborative efforts, we're not going to move the needle. Things are just going to continue to degrade or deteriorate, and we're not going to accomplish the goals that we need to, and that's getting people employed, recruiting people, retaining people here in the state of Wisconsin. Well, one thing I have to talk about is immigration. I'm a manufacturer. Manufacturing has always been done by immigrants. For 150 years in this country, it'd be the Italians, the Irish, the Poles, the Germans, and now the Mexican Americans. And people don't really realize the fact that there are a lot of legal immigrants in this country. We got to get them to come to Wisconsin. Other states are competing to get that labor, and we're not. We're not even trying. If we don't start going after that type of labor, the manufacturing industry in this state will disappear. The easy thing to do is leave the state. People do it all the time. You know, they end up going to Texas or Mississippi or Tennessee or wherever. They go to where there's labor available. The real answer is business has to step up. The real answer is they can't give up. They've got to engage. they got to be accountable. They got to be part of the effort here in the state of Wisconsin. If they're not, just turn off the lights as the last person leaves. I mean, we have to engage. This is really at a critical stage in our state right now. And I think as we have these pockets of excellence regionally, we have to make sure that those bubble up into something more important that can really be something that is universal and coalesce around the whole effort statewide.